Good afternoon and welcome to the latest in our series of webinars. Today we're going to be talking about health and social care apprenticeships. I'm joined today by Charlene, who's from Basingstoke College of Technology. She'll be taking you through the main content of what a care apprenticeship is, how it works, what you've got to do to get one. And as always, my name's Jodie. I'm from the Solent Apprenticeship Hub, and we're here to provide impartial advice and guidance around all things apprenticeships to individuals and to businesses. So if you need any help and support on your apprenticeship journey, please do contact us. The details will be at the end of the presentation. As always, there is a Q&A section on your screen. Throughout, please do ask us questions. No question is too small, no question is silly. If it is, I've probably asked it already, so please don't be scared of asking any questions. Without further ado, housekeeping. I always forget housekeeping. Please bear in mind we are working from home, so the usual IT things could go wrong. Please bear with us. Barking dogs, screaming children probably come from my house. Please do ignore and bear with us. We will get back to the presentation as soon as we physically can. I'm going to hand over to Charlene now. She's going to take you through the presentation, and I'll be back at the end to deal with your questions. Thank you, Charlene, over to you.
Lovely, thank you, Jodie. So
you'll need to unlock your iPhone first.
Good afternoon, everyone. My name for the Department of Spiral Learning. Today, I'm going to talk to you about the care apprenticeships. And on the first slide, there we go. Oh, we've just gone back one. There we go. So there's my details below. And we're going to be talking about the health and social care today. So I'm going to talk to you about the level 2 first. There are quite a few levels for health and social care, and there are different avenues you can go along. But I'm just going to mainly focus on the level 2 overall apprenticeship. So you are learning about being a primary role person for adult social care. You are the frontline staff helping the adults with either their support needs through showering, bathing, the personal hygiene, all the way through to maybe going shopping for them or taking them shopping. So it's all about their personal goals, what they would like to achieve, and also to make them live as independently as possible and as safe as possible as well. You could be working, when you do your level 2 apprenticeship, in a nursing home. And there's different avenues for the different types of nursing homes you can come across. Domiciliary care, so that would be just based in one place. You'll be all over the field in a certain area. So you'll be going to the customers' homes. You also have day centres. So it could be respite centres, a holiday centre where they come and have a week's holiday. Or again, it could be private care, so you're in individual's home. You also act as their personal assistant, so regardless what level you do in health and social care, you will be their personal assistant for that individual to help them with their everyday needs and to support them. But alongside the whole of the health and social care, you've got your confidentiality, your safeguarding, and the health and well-being of yourself as well as the client, and also the reporting aspect of the health and social care. So that's just a general overview of level 2. Your level 3 is more senior. So, for example, if you've done your level 2 and you want to progress to the team leader side or a supervisor, again, it's the same. So it's being part of the frontline staff, helping them adults with their everyday needs and their personal needs, but in a more senior environment. So you'll be the one who may have another apprentice level 2 underneath you. So you're helping them build the trust and gain and all the training. So it's more about how you would support the residents, but also others around you, so you're leading that team. You'll also be providing supervision for other frontline staff, and that could be people such as housekeeping or level 2 health and social care workers, support workers. So it's all about that supervision for the level 3. And you also be maintaining a high level of care provided when you're working with the care workers. So you'll be involved in implementing, like getting involved in the care plans, making sure you're making a difference. So someone, for example, could have a fall, and then they need certain equipment, for example, after they've had a fall. So you'll be more senior level to do that care plan, to evaluate and assess the situation. So that's all to do with the level 3. So additional information for any apprenticeship, if it's level 2 or level 3, is the entry requirements that the employer may need. Most employers will state if they prefer a level 3, but others will help get you through your level 2 and then progress you onto your level 3. You also need to have your Maths and English at a GCSE grade 4 or above. If you don't have your GCSE grade 4 or above when you're doing your level 2, we can then put you on towards your functional skills, Maths and English. Or if you haven't got the GCSE grade 4 but you have a GCSE grade C or above, that's fine. But again, if it's lower, then you would get your functional skills, Maths and English level 1, and then if it's a level 3 qualification, you do your level 2. Some people, they like to do their level 1 functional skills, Maths and English, and then progress on to their level 2. That's not a problem whatsoever. The duration between your health and social care, it does vary from 12 to 18 months for level 2 and level 3. However, if you want to progress onto the level 4 or the level 5, it is a longer duration. You have to complete 20% of the job training for any apprenticeship that you do. However, I will talk to you about this in due course through the presentation. Some people ask about the delivery of apprenticeships in health and social care. BCOT and other colleges and other training providers like Spiral Learning, where I'm from, will come to your workplace where you work. So we won't ask you to go to other colleges, other areas. Will come to you.
Charlene,
hi Jodie.
A bit of a problem with the sound quality that you've got. Could you just refresh and I'll take over this bit?
Oh yeah, what, close down and come back in?
If you just refresh your browser, that should sort the issue out, and then I'll just take over for this bit.
Yeah, no worries.
So as Charlene was saying, the delivery of the apprenticeship, you will do a lot of work with your employer, practical tasks, and all of the theory that you learn in an apprenticeship is essentially put into place in your workplace. So the whole idea of an apprenticeship is that you build up your knowledge, you build up your theory, and then you prove competence in your workplace. And that's why they're so popular with employers, because not only are you actually learning the theory, you are actually competent in doing the jobs that you are meant to be doing. So there's every apprenticeship comes with a standard. So the standards that are available are all available on the Institute for Apprenticeships website. The address is there. You'll see that there is over 500 standards, but there are 2 main care ones. One is the level 2 adult care standard and one is the level 3 adult care standard. There are also levels right up to levels 4 and 5, which is equivalent to foundation degree that you can also apply to a care. Right, I can see Charlene's back. So
I'm back. Can you hear me okay?
Yeah, much better. I'm going to go off and leave you to it. I've covered most of this slide, Charlene, though.
Oh, excellent. Lovely. Thank you. So on this slide, I've literally just put the links where you can go and have a look in your own time at the level 2 care standards as well as the level 3 adult care standards. And also on this website as well, you have got the level 4 and level 5 standards. So do just type in adult care and you will see the drop down what level it is, so you can have a look. So the summary of the assessment process. So this is just a little overview of what to expect in your to get you onto your apprenticeship. So you'll start off by registering for an apprenticeship. Within the actual apprenticeship itself, you'll get your diploma, so your level 2 or your level 3 in health and social care. You will also have your care certificate. Now, this is very important with the employer. They will complete the care certificate with you within the first 12 weeks of your employment. So that will actually come in tie with your apprenticeship. And you'll also have your maths and English functional skills. Unless you've got your GCSEs, then we'll use your certificates. So with all that embedded, you'll then have your portfolio side, so all your knowledge, your skills, your behaviour logs will all be part of that, as well as your witness statements and your observations. So the assessor will come in and see your competency in your job role. At the end, any apprenticeship, level 2, level 3, 4 or 5, you'll have an endpoint assessment where a company will come in and they will do a test with you. Normally it's a multiple choice test, as well as a professional discussion about your job role, what you do, how you've achieved the qualification. With all this information, your portfolio, all your knowledge and witness statements, and your off-the-job training, you'll then get your grade for your health and social care. So that's just a little overview of how it all works. Here you can see the progression. So if you want to start off as a health and social care worker, support worker, key worker, not key worker, ignore what I've just said there, the health and social care worker or support worker is level 2. Then if you want to become a key worker, team leader, supervisor, you've got your level 3 in leader in care and adult. Then you can progress to your level 4 lead practitioner. So if you're a deputy manager, if you're a supervisor but the higher band of a supervisor, you can do your level 4. And if you would like to become a registered manager, you can do your level 3 in leader in adult care. So you heard me talk about the off-the-job training. Now, this is what every apprenticeship needs to have embedded into their qualification. Now, this does not mean you have to take one day each week out of your job role. This could be information, what you've learned, your training that you've learned, all through your whole apprenticeship. So this could be shadowing other departments. So for example, if you work in a nursing home, shadowing the nurses, doing their medication rounds. Again, this is off-the-job training. Shadowing other roles, it could be shadowing the deputy manager, shadowing the business administration side. Again, this is all off-the-job training. Any online learning you could do, safeguarding, confidentiality, staff training. For example, someone could come in and change a catheter. Again, this is all off-the-job training. It's just examples. So anything you learn, it's all to do with off-the-job training, and this will be fully documented in your portfolio, which we will embed in your qualification. Here's a few that Aspire will learn and work with. Again, there may be some here that you might come across. Again, there are a lot of other companies that we do work with. There's a lot of care homes around. So do have a look on the websites to see who are taking on apprentices at the moment. So what you should do next. So you can find out apprenticeships on the NAS, and that's the National Apprenticeship Service link below, which you can see. Also have a look on Indeed. There's a lot of job vacancies there, and the BCOT vacancy page as well. We've got care assistants, apprentices we're looking for at the moment on the BCOP page. Please also do send your CV to us. I've put the email address down as well, so you can send us this CV, because when we do find vacancies, we could forward your CV onto them companies. But do have a look through all the different job sites as well. Even type in care assistant or senior care assistant, and when you do enroll and apply for them companies, they are very good at wanting to put you towards your level 2 and level 3 in health and social care. So don't just look for maybe an apprenticeship, have a look, put care assistant and then search, and then most of the time they would put you towards your apprenticeship, which is really good. And any questions? And I think this is where Jodie comes back.
Charlotte, can you hear me?
I can hear you.
Right. So the first question is, do I need to get a DBS check done prior to applying for this role?
So normally when you apply for a job role in any care home, they will do the DBS for you. So they will send you the forms, you fill it all in, you send it back to them. And what they will then do is, once the DBS has come back, that's when you can start.
Our next one is, what's the average pay rate for a level 2 apprentice?
Okay, so normally they would pay averagely, I would say, £9 per hour. However, weekends they do £10 per hour. But normally, I'm from the Basingstoke area, and on average, I would say around this area alone, it's the minimum of £9 per hour. It's very rare that they do national minimum wage, purely because of the job role in itself and what it covers.
Yeah, I think because of the personal care, you know, you are in a position of real responsibility almost from day one, aren't you?
Definitely, yes. And you always find as well, when you've done your level 2, you would go on to that higher band. So if you want to do your level 3, they tend to put you on that extra little bit of money, and then once you complete it, you can go up as well. Excellent.
Sounds like a nice career path.
It is. If you want to become a registered manager, and that's the way forward, definitely. I've signed up many people onto their level 2, and I've gone back a year later and they're doing their level 3, and then before you know it, they're more senior. So it's lovely to see.
Excellent. Another question here for you, Charlene. What are some good characteristics or qualities for someone who wants to do an apprenticeship in health and social care?
So the big characteristic is definitely you've got to be a caring person yourself. You need to be approachable. Like I've done care myself, and I still do now. And it's nice. You have to be approachable and forward. Someone willing to talk to, smiling, and would go that extra mile. So, you know, you've got to have that care, soft approach, definitely. And you need to be patient. Definitely patient for the job role.
So if you were a young person looking to go into this, the sort of thing you'd want to see on your CV is, you know, perhaps babysitting duties, things like that.
Definitely. Babysitting duties, supporting in the community, if there's anything you do, supporting, any hobbies and interests you like getting involved in. Because when you are working in the care home, the residents, they do like to know your hobbies and interests and what you do outside of the world of a care home, and they love hearing the stories. So definitely.
I can imagine. Right, I've got one that's a little bit more unusual. Does this apprenticeship apply to someone wanting to do midwifery?
We do. There is courses for midwifery. You can do your level 2 health and social social care. However, that's more based in a care home and like the adults or young adults, really. It can be young adults as well. With regards to midwifery, there is level 2s out there, which is solely for that and hospital based. So if that's the way forward, I would recommend going down that path. But when you get to, like, for example, your level 3 in health and social care, there are different pathways you can choose, like dementia, nursing, and learning difficulties. So there's all different pathways you can choose.
Yeah, just to add into that, Claudina, if you want to speak to us specifically about midwifery, please do contact us on the email address and we can give you some links to the best pathway. There is a healthcare support worker, which is more hospital based. There's always a lot of vacancies. People are really keen, and certainly I know our local NHS trusts are really keen to get people into apprenticeships at that level and then move them up and through. There's also obviously the nursing degree apprenticeship, which is hugely important, maybe where midwifery comes more into it. But please do contact us and we'll arrange to have a one-to-one conversation with you about that. Right, Charlene, next question. How has COVID-19 changed the health and social care vacancies?
Okay, so all through the COVID-19, I've been very busy with getting vacancies on board for the local area, and it has affected it when we can't come in and observe you. However, we can still remotely speak to you. We can get the ball rolling with your maths and English, with the induction side, as much paperwork aspect as we can do with you. So that's not a problem. But yeah, no, in my eyes, with regards to the vacancies, the care sector is still looking for apprentices as we speak, and there are a lot of vacancies out there at the moment. It just means your interview could be maybe via Zoom instead of face-to-face. So that's just something to bear in mind at the moment.
Absolutely. And obviously, certainly care workers and key workers, of course, have been really celebrated through this period of this pandemic, and I think it's highlighted what a rewarding career it can be.
Yeah, definitely.
Next question, do I need to complete a level 2 course to enroll onto a level 3?
No, not at all. So if you go to a care home and you've done, or you're doing the medication rounds, you're getting involved in the care plan aspect of it, if you're not, you don't have to be a shift leader to do your level 3, but if you've got the knowledge there, then there's no reason why, and you've got the maths and English grades, there's no reason why, if the employer is happy as well, for you to jump straight onto your level 3. That is not a problem. We just need to make sure you're competent enough in that job role, and there's enough knowledge there we can get you through, like the portfolio side and the witness statements and the evidence there, to be able to do your level 3. It's not a problem.
Excellent. Next question, do you have to be qualified to work in care?
No, you don't need to be qualified to work in care. Again, I've done care in the past, and I had no experience, and I went in, got the qualifications that I need, and that's one thing I like about health and social care. You could have done something totally different, and then you want to go into care. They will support you through your level 2. They'll support you through your care certificate. And once you've got your care certificate, there's no reason why you can't progress and do your level 5 and eventually become a registered manager. So no, as long as you're willing to learn new things and be patient, then health and social care will be fine.
Lovely. One of our last questions, I think, do care homes offer work experience?
I haven't come across work experience per se for myself. However, there's no reason why you can't ask the care home. If you've got a specific care home that you would like to do work experience in, give them a ring. Tell them why you want to do the work experience. You would need to speak to them because of the whole DBS. Obviously, you'd need a DBS check. But again, that could be something they could look into for you. But it would be something more the employer would have to agree with and work out what's going to happen with what. But for us, work experience for care, we haven't come across that yet.
I think it's one of those things that, you know, in a care home, especially at the moment, but probably if we think about either before the pandemic or after, due to the nature of the work, you know, the personal nature of the work, it's sometimes really difficult to get experience in care homes. However, if you wanted to go in and do some reading or, you know, an activity, perhaps help out in art class, things like that, that might be way more approachable for someone, for them to need just extra pair of hands rather than do the actual care work. Then you might find care homes they're a little bit more approachable by that.
Yes, definitely. I would agree there, Jodie.
And I think that brings us to the end of our questions. Let me check. So I would like to say a huge thank you to Charlene for taking us through all of that brilliant information. Thank you. As she said, you know, if you do want to send your CV into BCOT, the contact details are obviously on the presentation. This is recorded and will be uploaded to YouTube. So if you need to refer back to anything, please go to our YouTube channel at Solent Apprenticeship Hub. Our contact details are on there. Please follow us on various forms of social media. But if you do have any specific one-to-one questions that you'd like us to help with, pop us an email, look at our website, fill out the contact us form, and we'll get back to you as soon as we can. Thank you again for joining us, and this concludes this webinar.
Thank you very much. Thank you.
Thank you, Charlene.
Thank you.